Welcome YouTube, it's Jason Darcy. I've thought long and hard for a video for you today. I'm going to do a lower back and glute video. So we haven't done one for a week. So I thought, why not? Let's treat Darcy's back and glute.
Yeah, it's tight
So
anyway,
it's probably
man.
the most common treatment that we do in the clinic. People sitting down, desk workers, tradies, people spending a lot of time in the car. So
lifters.
if it's the most common treatment, it needs to be the most common video to show you how we treat it.
Yep. And it always changes a little bit.
It always changes, yep. So we start with a nice broad palm on the sacrum. So we want to connect with the bone to start with. Yeah. So this is just a nice therapeutic sensation. So the heel of my palm contacts with the sacrum, and there is a thick layer of fascia that covers that sacrum. So that's why we want to connect in with that. Yep. If you lack a bit of movement through your hips and your lower back, this just feels good to get a nice sort of compression through it. I can even do a little bit of a bounce. I can lean over and put more weight through it. But chances are you've probably never had this part of the sacrum actually treated. People probably treat through the glute, treat through your lower back, but they don't actually compress and work through this sacrum. So this can actually help to mobilize and open up so much of these tissues. I can angle down. I can actually apply a bit of traction here, just so we sort of almost like decompressing that lumbar spine a little bit.
Yeah, feels good.
Or I can start to lean over it and open it up that way. Now I'm moving out more towards the glute and start to hit those glute tendons, but the pressure is staying the same. I'm still pushing down towards the table, but I can just change my angles from out, straight down towards the glute. And we're just feeling for where there's potential blocks or sticking points and just, picking up on those. And then we're just slowly working out. And we can hit into those glute tendons. So if you are new to our channel, like and subscribe so you can get constant updates of how we treat pain. We've just done a calf treatment and a series of how to fix a calf injury. So Darcy treating myself. So give that one a look as well. But if you're also looking to build your strength or go through corrective exercise, we've also got exercise videos as well. So jump on, give us a like and subscribe, and comment if there's any particular conditions you want treatment demonstrated on. We also provide advice for practitioners if you're looking to improve your treatment technique or your method. You can also jump on and also join a course where Ninja and Aaron teach you how to do our specific treatment techniques. So you can hit all the key money spots in the body. You can fix chronic pain, acute injuries. So if you're interested at bettering your own treatment, jump on and book an interview with Aaron or Darcy. You can talk a bit about the course and see if you're the right fit to jump on and join in. Join the MMT crew. But now we've just moved into our lower back money spot. So I'm just going to sink out to show you where this is. So if you're new to our channel, you don't know what this is where your lumbar spine meets your sacrum. So right in here, there's a lot of muscles, your erector spinae. Deeper to that, there's the QLs a little bit wider. And then there's also a lot of nerves that exit through that area. The thoracolumbar fascia comes in here. So it's such a key point in the body that gets really tight and stuck, and a lot of pain can originate from this area. So I'm just going to sink my palm in there. And then for now, I'm sort of pushing down, and then I'm going to angle back in towards that corner. So I'm trying to get in here and really spear into there with my palm. And straight away, if you've got lower back pain and this is the spot that's producing your pain, you will feel like, that's the spot that I need to get treated. It just feels nice to have that connection with it. And then we're just going to slowly work to trace our way around the top of this iliac crest where those lower back muscles are coming in and attaching. But it's just changing subtle angles. So now I'm pushing more down towards the table, or I can angle more straight towards this glute or to the other side. Is there one that feels more your sensation, Darcy? More
I think
that
down
way?
Towards the glute.
Yeah, that's where I'm feeling a bit more of a block. So it's important to go slow so that we can explore those different angles, because it can be a difference from me angling this way to, that feels all right, to angling straight down to the glute, that feels like my pain. So we want to connect with that pain. If we're doing really fast moving strokes, you don't get to pick up on that, but also it's not as therapeutic for you on the table as a receiver. Although sometimes you want to feel the pain of the treatment, you want it to be a good pain. You don't want it to feel like you're having to protect yourself against someone really pushing past that boundary. So because we're going slow, it can be painful, but you're actually more receptive of it because the sink in is slow. Yes, we're getting that deep level, but you're able to actually breathe and relax into it and accept that pressure a bit more. We're not going past that pain barrier where you're constantly having to guard and protect, and yeah, it's feeling more traumatic than beneficial. And then we're just slowly working our way out. So once we've done a couple with the palm, I actually like to do one coming up here so we can open up through that lower lumbar area. So again, starting on the sacrum, connect in there. And this, I can also sort of grab onto the hip here a little bit so we can sort of traction down. This can just provide a little mobilization. I can also move the hips a little bit. And we're tracing up this lamina groove. So just on the inside of the erector spinae, which is this muscle you can see on Darcy that runs the full length of your back. We're just in that groove there.
Oh, feels great.
And connecting in. If we find something, we can just slow down, sit on it for a little bit, and then we're slowly moving up. So this is a bit more of a palpation stroke for me, so I'm taking note of where you might feel tight higher up in the erector spine and this muscle group. There's normally a bit of a sticking point for people around this sort of lower rib area, that sort of thoracic and lumbar junction. A lot of people can have a bit of a hinge point in there. So we can just park there, hold it. This is where we can actually start to move the hips a little bit.
Oh, yeah.
And we're just trying to create a little bit of like rotation through the spine there.
Yeah.
It's just a bit of a mobilization without actually like me pushing down and trying to crack the back. It's just a way that we can start to get those little segments moving.
Feels great.
And then we can start to keep moving up.
Oh, yeah.
You feel like a bit of a block there.
Yeah.
So now you can see I'm just sort of wiggling a little bit. It's just trying to create a bit of a mob in there. And then once that tissue releases, now we've started to move again. So I'm not trying to force my way through and move really fast. It's just going at what that tissue's allowing. So at the moment, it feels like it's a bit stuck there. So I don't want to keep flying over it. I want to just go at the pace that I'm actually able to move through that tissue. As it's melting, that's what's allowing me to move. I'm not trying to force my way through it.
Oh. Wow, feel taller.
Yeah, that's it. This is a really good one for like decompressing that lower back. You can even come around the side here, Leo. You can probably see now Darcy's spine looks quite flat. Maybe come down the side here from the table view. We're sort of opening up through here, but when I started, and even if I sink out, he has this bit of an anterior tilt, where when I pick up the tension here, you can see it almost lengthens this part of the back. So yeah, people can actually get up and feel a bit taller, because if this is all really taut and tight pulling him like this, his spine's actually going to be compressed in that area. So if we can create some length through here by opening up through the sacrum, opening up through those erectors, that's going to help to create some length and decompress these joints in here. So now we're going to do the money spot with our elbow. So what you can do is you can palpate the spine just so you're not going to actually push down on the spine. We want to be right next to it.
Oh.
And now we're just slowly sinking in. So my elbow here is in contact with the pelvis there. And then my inside of my elbow is just inside the spine, all right? And then I'm sort of pulling back on an angle towards Darcy's opposite glute.
Feels great.
I can just pivot my forearm so that different parts of my elbow can get into that groove. And then we can start to just slowly change our angles. Again, getting feedback of which way feels more for you.
Oh.
Pulling back that way.
Yep.
That feels like it really connects in, and now we're spearing in this way. And once we've connected with the pain and we've felt it soften, then we want to start to clear it out. All right, so then we want to start to trace around this iliac crest again.
Oh.
It's all about stagnation versus flow. Where things have become stagnant in the tissues, whether they've become hardened and solidified, dehydrated, those tissues aren't moving as well, those joints aren't moving as well, that's where the muscles and the fibers start to become stuck. That's where pain originates. So by increasing blood flow into this area through just having a slow, deep, constant pressure, those tissues become hydrated, the fascia becomes hydrated, which is the connective tissue that connects your body together. And then you can start to elongate these muscles, get them back to their normal state so that they have that elasticity to contract and shorten, but then also lengthen and return to their normal state, and they're not stuck in this constant state of fight or flight. All right, so that's why we're getting this slow pressure and working through there.
Oh, yeah.
Now just pivoting, working out. Got to take it slow as we go over these erectors. You don't want to flick over them if people are quite taut through the erectors here.
Oh. Wow.
You can see it's starting to move a bit quicker now, so it's not as tight out here. I'm not trying to push through there faster. That's just what the body's allowing me to do. And then we'll sink out of there. So we can spend longer on that, and we can do another stroke up here, but for video's sake, I'm gonna show you into the glute now. So just the key spots in the glutes. Sorry, Leo, maybe duck around the other side. So you want to hit where the glute attaches onto the sacrum and around the pelvis here, and then where it attaches onto the greater trochanter. So we're just going to do the 2 lines through here.
Yep.
So we connect in, sink in there.
Oh,
So we're angling in, under, and connecting with those deep tendons there.
Oh, yep. Oh. Wow.
So often when you're sitting down, these glutes get short and tight, and that can also hold tension in the lower back as well. So what we actually want to do is promote lengthening through the glute. So that can be through a hip hinge pattern where you're really extending the hips, you're creating length, but then you're actually able to contract and activate them in the shortening phase when you're standing back up. All right, so a lot of people get given banded exercises, and they can be helpful at activating the glute, but we want to also start to lengthen the glute and be more functional through that hip range, which is more of a hip hinging type pattern. It might be more single leg stance if there's more of a one side imbalance.
Oh.
So this is all things that we can go through as an assessment when you come in for your first session. So picking up whether we actually need to look at the front of the hip as well. If you're really locked up at the front, that can also be contributing to issues at the back here. So staying connected with that sacrum and those tendons. Then we're going to trace around the iliac crest. So glute max, piriformis as we come around the side, glute medius and minimus.
Oh. Feels good.
And same thing with when we're in the lower back. When we find the spots, we want to deal with them and treat them and fix them. Make sure we clear them up.
Yeah.
So if that means we spend 10 minutes through a glute just doing this one line, if that's what it needs, that's what it needs. We're not just sticking to a playbook of I've got to do one stroke through here, one stroke through there. As a practitioner, you need to have, you need to be able to vary your treatment for what that person needs in front of you. There's no one treatment fixes everyone. You've got to be able to adapt. So now we're getting those tendons that attach onto the greater trochanter. Sorry, lost my words there.
Oh.
And then angling in. This is more those deep hip external rotators.
Oh, wow.
And tracing our way around.
Oh, yep.
This can be quite uncomfortable, but it feels good once you're done.
Feels so good.
And you don't always need to come in and get treatment when you're in pain. This can be a maintenance session as well. If you're someone that's had previous issues and you're now out of pain, you might just come in once a month, something like that, where you're just getting on top of anything. If you've got a physically demanding job or you're training a lot or you are quite sedentary, sometimes getting treatment just once every month, yes, you might not necessarily feel pain, but you start to pick up on areas that get tight and you get in front of it. So you don't wait until things blow up again and you've got to come in and get that regular treatment to fix it. So maintenance sessions are good because you can actually enjoy them a bit more. You're not in the discomfort of when you've got acute pain or back pain that's been going on for a while, those muscles aren't as tight, they're not as sore, so you can actually just enjoy the treatment a bit more. So that's another beneficial thing of getting maintenance is, you can just enjoy a session.
Oh.
We're working around that greater trochanter all the way.
Yeah.
And then we slowly sink out. That's another thing, is sink out as slow as we sink in. All right, there it is. So if you're struggling with lower back pain, glute pain, this is the treatment we can do for you. So thanks guys, we'll see you next time.
Awesome, Jace. Thank you.